You are about to hear the feedback and discussion following an observed telephone consultation. If you have not done already, we would recommend that you listen to the consultation before continuing. The telephone consultation is available to download from the workplace-based assessment part of the RCGP website. We would also recommend having a copy of the audiocot assessment tool available. This feedback is between a GP ST3 who has completed their CSA and their trainer.
So we've just listened to your telephone triage of a patient wanting a sick note. How do you think it went?
I was perhaps on the phone longer than I wanted to be with him for what was a relatively simple request. Was the main thing that one of the main things I was thinking as I was on the phone. With regards to actually the sort of the content and the outcome, I suppose I got, for the most part, what I wanted to get across, and moved him from a position of, can you give me something to go back to work today, to try and have a discussion about why I didn't think that was a good idea. And I thought he was fairly receptive to that.
I think he was very receptive to that, actually. So, as a global thing, I think it was a very effective consultation. And what I'll do is I'll go through my marking scheme of the audiocot and say exactly why I've put what I've put. So, item 1, consultation introduction. This is about introduction and establishing identity. I've put excellent. I think you took his name, you took his date of birth, you introduced yourself. I think that's entirely appropriate, and so well done. What I'd like you to do is comment back. Doesn't necessarily mean I'm going to change the marking, but if you feel that what I've written doesn't quite fit your thinking, then just let me know why. Okay. Establishing rapport, I think I've put here competent. You establish rapport very, very quickly, which was great. And he was very open. He was an open gentleman anyway. So
it was particularly difficult thing with him.
So the information gathering area, exploring the reasons for the telephone call. You used a nice open phrase, how can I help you? It was timely, it was quick, and he launched straight into the reason of a sick note. So that was entirely competent. Encouraging the patient's contribution using appropriate open and closed questions. And you use the open and closed nature of the questions in really an excellent manner. So you wanted to know what he did, why he wanted it, the swelling was brought up, and you recognised that he had mentioned that. You didn't talk about it at that time, you came back to it later, and that was entirely timely. So I've given you an excellent for that. Place complaint in appropriate psychosocial context. Well, throughout the whole consultation, you managed to get the fact that he was a scaffolder, that he's on a heavy job which would involve heavy lifting. You talked about doing alternative things. He talked about needing overtime. So all of these things were gleaned, and you were weighing up why this was important to him, but also the appropriateness with the nature of the operation. So you're happy with those so far?
Yeah.
Okay. Explores patient's health understanding, beliefs, including identifying and addressing patient's ideas, concerns and expectations. This, I've put an excellent because you really interrogated him about the ooze, the pain, the temperature. So you were asking him about his understanding, and more than that, you also used a fantastic phrase. How long did you have off with your first hernia repair? I was unsure, I must admit, whether it was the same side or a different side. So had the first one recurred because he was inappropriately off for such a short time? I was unsure, but actually, sorry.
Yeah, so I think it was the same side.
Okay.
And he'd mentioned about that they'd done a botched job, I think, which actually I perhaps could have used that a bit more.
To say you've got to leave it a bit.
Usually, but else, it's going to be a botched job again, inverted commas.
If you go back to work too. Then defines clinical problems. So this takes an appropriate, thorough and focused history. And I think you were entirely thorough, especially about the situation at the moment, the ooze, the redness. I would have liked, I've given you a competent on that because I would have liked to hear you, as you've just said, interrogate, because it's the first time, was it a botched job due to the surgeon, or was it a botched job because you went back to work too early? And I think that might have pushed your case a bit further. Makes an appropriate working diagnosis, absolutely. That's entirely competent. Now, management plan construction. I've given you a competent for. This creates an appropriate, effective and mutually acceptable treatment. And you moved him from 1 week, I want to go back now, as you've already said, to let's give it another week. And you didn't inappropriately bring him back now. He said, shall I come and see you now? And you used a lovely phrase there saying, well, I don't think it's going to change what I'm going to do. Yeah? Which is entirely true. And then he said, well, shall I come back and see you in the week? And you were using resources very effectively. They're saying, actually, you're the best person to know whether it's ready to go back, not me, because, I can only see the outside. I'm not going to change what's going on inside. Now, sorry.
I probably would have actually, I think with hindsight, would have perhaps suggested that he's not changed his dressing for 2 or 3 days. Why doesn't he, if he's worried about it, why doesn't he change his dressing today and have a look himself?
Brilliant.
And if he's got any worrying features, then he can call us back.
Okay. I think that's great. Closure of the consultation, I think it came to a natural end. He was wanting to close it as you were. I've given you a competent for seeks to confirm patient's understanding. I think, although it wasn't stressed precisely, I think you'd got it out of him, what's going on throughout the consultation. Yeah. So that's a global competent rather than a precise competent. Rather than you using those words. Relate back to me what you understand.
I mean, he struck me as being someone that was, pretty switched on for the most. It didn't seem particularly daft. I didn't really want to sort of undermine his intelligence by saying, now tell me exactly what I said and what you're going to do too much. I think from my feeling was there was a bit of an implied understanding from his sort. I suppose be my comment on.
Brilliant. Yeah, no, that's good. Provides appropriate safety netting and follow-up. I think you did that. You talked about what to look for. You interrogated him for about his bowels as well. Now, the last bit, effective use of the consultation. Although you said you think it could have been shorter, I think it was very effective because it was quite a complex consultation. So this is, an 80-year-old with a hernia op who probably doesn't move around much. That's a completely different to an active, heavy lifting individual with a hernia op. So I think it was effective use of time. Communicates risks and uncertainty. I think you've told that. You stated that. Look, you need to give it another week. I gave you a competent for that because I think the excellent would have been actually the ideal is 6 weeks. That's the maximum scarring. And that would have sort of immediately.
And I think I toyed with the idea, and probably what I should have said for the sake of being open and making him make a truly informed decision would have been to say the actual guidance is you should be having 6 weeks off, but I hear what you're saying about work, family, everything else. Certainly I would definitely give it 2 weeks and then the rest is up to you.
Okay. Brilliant.
Perhaps a better way I could have put it.
Appropriate consultation time to clinical context. I've given you an excellent because I think it was a complex situation. I don't think you could have dealt with it in a shorter time because of the necessity of him wanting to get back to work and the nature of his work. We have looked at the records, and there's everything in the records that there needs to be, and they're not unduly wrong. So overall, is this a safe consultation? Yes, I think it's entirely safe. The patient knows when to come back or why he should come back, and you didn't bring him back unnecessarily, so he could go back to work naturally at the end of the 2 weeks. Under the agreed action, I certainly think the nuts and bolts of the consultation about 6 weeks for maximal scarring, and also mentioning perhaps the recurrence may be partly his fault as well as possibly a botch, might have been a way to talk through this. Are there any other areas you think could have improved on that?
No, I mean, I think those were my main issues, if I'm honest, about sort of time period and communicating that to him.
Brilliant.
Yeah.
And I think you've reflected on the areas that you think could have changed through this audiocot. So overall, I think this is a competent audiocot assessment. Okay.
Thank you.
Thank you.